The last category of the drugs for constipation is osmotic purgatives. Now, what do we mean by osmotic? Is they actually cause osmosis. Osmosis means these are actually chemically active agents which absorb water to them. So these are called osmotic purgatives. In that we have the magnesium salts, and these are used in so many drugs like in cremazine, milk of magnesia. There are so many liquid forms of the drugs for constipation which contains this magnesium salt, which can be in magnesium sulfate, magnesium hydroxide, and sodium salts also are available like sodium sulfate, sodium phosphate tartrate. So these drugs are basically, these are the solutes that are not absorbed in the intestine, so they remain in the intestine, and as these are osmotically very active, they actually retain water osmotically. So just consider this is a magnesium salt. As soon as it comes into the gut, it will actually absorb water and it will increase in the size. So more and more magnesium salts are there, they will swell up, they will take up all the water around them, they'll keep water around them, and they will increase in the size, so that automatically they will increase the stool volume. So they distend the bowel, and that is how they help to increase the peristalsis. Because more is the stool volume, it is very easy for this gut to push this stool forward. It is very easy. If the volume of the stool is very less, it is very difficult for the gut to push this stool. But if the stool volume is good, it is easy for the gut to push down or to propel this stool towards the anus. This magnesium salts or magnesium ion has an extra edge. It releases the cholecystokinin or CCK from the gallbladder, which actually is supposed to increase the motility and secretion of intestine. So intestinal contractions as well as secretion of water and electrolytes is increased by this magnesium salts. That is how it increases the peristalsis and secretion of the stool. Uh, all these inorganic salts or the osmotic agents, like whichever are there, like magnesium hydroxide, magnesium sulfate, sodium sulfate, sodium phosphate tartrate, they almost have similar action. So how do we give it? Just take around 200 ml of water and this 15 to 20 ml of this syrups, and 1 to 2 fluid evacuations usually occur within 1 to 3 hours, and the patient may get mild cramping. We must also remember the contraindications. Sodium salts we know can cause marked sodium and water retention, so that can be detrimental to the patients who have heart failure. So chronic heart failure or ischemic heart disease patient, we should be very cautious and we should actually try to avoid these drugs. And magnesium salts should be cautiously used or should not be used at all in patients with CKD or those patients who are on maintenance hemodialysis. The third important drug is lactulose, which is extensively used in India. This comes in so many brands like Dufalac. There are so many brands which has this lactulose as a content. It is basically a semi-synthetic disaccharide. It neither gets digested nor get absorbed. So it remains in the small intestine only, and as it is an osmotic agent, it will absorb water on it. So it will increase in this size, it will swell up so that it will form a large volume of the stool. The other thing is key, flatulence is very common with this drug. So there can be increase in the gases in the abdomen. So patient may complain of bloating or indigestion. If the patient is complaining of bloating, then actually lactulose should not be used. And the other drugs can be definitely used. This lactulose has one extra edge in those patients who are chronic alcoholic, or those patients who have hepatic encephalopathy. Those patients in whom serum ammonia is increased, in those patients who have CLD or chronic alcoholic liver disease or liver failure because of any reason, in them ammonia is increased, and this ammonia gets into the brain and it causes cerebral edema or brain edema, and the patient may worsen. So in those patients too, this Dufalac or lactulose had shown to reduce the ammonia levels by 25 to 50% of their baseline. So this drug has special role used in those patients with CLD, with alcoholic liver disease, or in any CLD, or in any acute liver failure with high ammonia. Lactulose can be given 15 to 30 ml 2 to 3 times very easily to cause at least 3 to 4 motions per day. So most of the time, the lactulose produces soft stools in 1 to 3 days in normal patients. And one of the good quality of this lactulose is it is safe in pregnancy and can be used. Thank you.